Hi, Dr. Yass here. In this video, I'm going to talk about the point at which I believe the greatest chance for misdiagnosis occurs. Basically, what's happening is that you're having pain, you're having dysfunction, and you're seeking care from a medical practitioner. Let's say, for instance, you're having a problem in the hip region, and so you end up going to an orthopedic surgeon. I want you to understand the reason why there is the highest probability that you will not be diagnosed properly. And I just ran into this with a guy I did a Zoom session with yesterday, and I think it really typified this understanding, and I think it's probably, when you hear about this, going to be quite common to your circumstance. So this gentleman said that he was having pain in the front of his thigh. It's in the front of his thigh, and it's affecting his ability to do most activities, bending down, even trying to put his sock on. The guy's a golfer. He can't play golf. All his symptoms are exacerbated by activity. So it's progressively worse, and then it's gotten to the point now where it's affecting pretty much all of his activity. If he sits for a while, he has difficulty standing up, all this type of stuff. So eventually he says, I've got to seek some sort of care from the medical system. So he goes to an orthopedic surgeon. He goes to his primary care, and his primary care jiggles his leg or something like that and says, I think it's your hip, and you got to go to an orthopedic surgeon. Goes to the orthopedic surgeon. The guy jiggles his leg a little bit and straight out, almost immediately says, you need a hip replacement, and wants to schedule it immediately. The guy is clearly taken back by this, that for what appears to be pain only associated with activity, he doesn't have pain if he's sleeping, if he's sitting, anything like that. It's just when he's trying to move, to say so abruptly that he needs a hip replacement and that it should be done immediately kind of puts the guy into shock. And he's like, listen, I got to think about this. I got to process this. And so I'm not ready to make that decision right now. So it turns out that the guy happened to know a guy that I've treated who's a good friend of mine. And this guy had him do a session with me. And so as he's telling me this story, that he's trying to explain his symptoms, and when I say symptoms, not just pain, but where the pain is, what brings on the pain, all these type of secondary issues that help to corroborate what the tissue is in distress eliciting the pain, the doctor is having no part of this. No part of this. He straight out simply, he said he just jiggled his leg a little bit and boom, he needs a hip replacement. And the most frustrating aspect for me, and the thing that you must be aware of, is that the doctor just straight out says, the hip could refer pain to the front of the thigh or the groin area. And that simply is a fallacy. It's a lie. It's impossible. If you had some sort of structural variation that would create pain, it would create pain where the structural variation is, which is in fact in the joint, the hip joint. So if you had an arthritic change or a labral tear or something like that that would to elicit pain, you could only have pain at the hip joint. There is no such thing as a joint referring symptoms anywhere other than within the joint. So the idea that he could just haphazardly say, the hip joint can refer pain to the front thigh or the groin, is just a lie. You're not in a position to know that. That's where the danger lies. This is the point where you must understand you need an arbitrator. You need somebody that you could go to that could say whether what you were told is valid or not. Right now, as this guy described, he goes there with nothing more than faith that the doctor knows what he's talking about. But the evidence is clear that whatever he thinks he knows is clearly not accurate, because the failure rate for these surgeries is astronomical. At this point, I'm pretty sure they're doing more revisions for hip and knee replacements than they are hip and knee replacements. So you have to understand that it's the dynamic of this situation you find yourself in. You're speaking the language of symptoms. They're speaking the language of structural variation identified by diagnostic test. These two do not go together well. These typically indicate that these are not the cause of these. When someone says they're having symptoms at the front thigh and someone tells him that it's structural from the hip, that simply can't be. When the individual says that the thing that brings on the symptoms are movement, standing, twisting, bending, and they're told it's structural, that can't be. But you're going to a person who doesn't know the language of symptoms. They're not educated to know the language of symptoms. They're educated to find structural variations on MRIs and X-rays and simply say that that's the cause of your symptom, regardless of what symptoms you're experiencing. That's it. So if you can understand and wrap your head around the idea that there's really nothing medical that's impeding you from getting the proper diagnosis, it's the dynamic between you and the individual that you're seeking your care from. That's where the lapse exists. You speak two different languages. You speak symptoms, they speak structural variations. In my experience, over 28 years of treating thousands of people, I have found that only 2 or 3 cases over thousands, over 28 years, the actual presentation of symptoms indicated that the cause was structural. 2 or 3 situations. The other multiple thousands of people who were told, due to a positive diagnostic test, that the cause of their pain was bone on bone at the knee or the hip, or that they had a herniated disc or stenosis or any of this nonsense. And it turned out that the cause was muscular, even with the structural variation identified, was in the thousands. The 99.99999% of cases. The difference between me, the Yass method, and the medical establishment is that I speak the language of symptom. The method is based on that. The diagnostic model of the Yass method is quite simply structural variations, each being specific, a bone, a muscle, or nerve, creates a very specific set of symptoms. Therefore, if you interpret the symptoms, you could identify the tissue in distress. It turns out in 98% of cases or greater, the tissue in distress is muscle. So the nice part is, with targeted progressive resistance exercise, you can resolve the cause of your symptoms, thereby ending the need of the tissue in distress to elicit the emergency signal of pain. So let's be extremely clear. The medical system, no language of symptoms. Only diagnostic test. I find structural variation. Your hair could be on fire, but it's from a herniated disc because I found a herniated disc on your diagnostic test. That's the medical system. The Yass method, I listen to everything you say. I do physical evaluations. I try to interpret what the body's trying to tell me so I can determine what tissue is in distress, creating all those symptoms that you're experiencing. Again, in 98% of cases, if not greater, the cause is muscular. So we're able to resolve the cause through targeted progressive resistance exercise, which has nothing to do with physical therapy, weightlifting, fitness, or any of that stuff. This is a type of strength training that I developed during the process of me weightlifting for 35 years, putting 64 pounds of muscle on, and treating over 15,000 people. Okay? So, that's what this is about. That's where you have to understand why entering the medical system pretty much guarantees failure of a proper diagnosis, thereby leading to worthless, baseless treatments that were never going to fix your symptoms in the first place, right? You don't want to get that back fusion or that hip and knee replacement and go through a couple of revisions before you suddenly realize none of that was ever going to work. If you're having symptoms, the key is to understand the symptoms mean something, and therefore you have to go to somebody who can interpret your symptoms to identify what tissue is creating those symptoms. That's the Yass method. It is outside the medical system. It is a fitness-based program because in more than 98% of cases, the cause is muscular. So in this particular guy's case that I treated through a Zoom session yesterday, we did a series of exercises. I believe it was 4 exercises. The guy noted that if he single leg squatted, he literally could bring on the pain he was experiencing, the pain he has been complaining about, the pain that impedes him from doing what he wants, the pain that he sought medical care from. We did the 4 exercises, and he was able to do the single leg squat without symptom repetitively several times more than before we did the exercise, and he was able to bring on the symptom intensely with only 1 or 2 times of trying to do the single leg squat. That's how the system works. Okay, so it turns out it was muscular. Whatever that guy was telling him related to his hip had nothing to do with anything, whatever he thought he saw. And I can assure you that if he got that hip replacement, and that's what I told him, his problem would be much, much worse because the post-surgical symptoms of pain and swelling would have caused his quad, front thigh muscle, which was eliciting his pain, to worsen, have a greater difficulty in supporting him in doing activity, and would have strained further after the surgery, which is why people end up having more symptoms after their surgeries. It's not confusing. If the cause is muscular and you have surgery, you have more muscular deficits. That's just the way it works. So, if you hear this and it's making sense to you and you'd like to contact me to ask a question or possibly get your own Skype or Zoom session so we could evaluate you through an interpretation of your symptoms, if we confirm it's muscular, show you the series of exercises and get you on your way to being pain-free and fully functional, you can contact me at my email address, drmitch@mitchellyass.com, drmitch at mitchellyyass, drmitch@mitchellyyass.com, drmitch@mitchellyass.com. If you like this video and it makes sense to you, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, you like the type of information I'm putting on, it's all applicable. It's all trying to guide you and provide you the information so you can make better decisions about your diagnosis and treatment, so you are not dependent on a medical system that is incapable of interpreting your symptoms, which is basically the way that the body lets you know what is wrong. If you like these types of videos, please subscribe to Dr. Mitchell Yass so you can get notifications when new videos are added or when I'm live on YouTube. All right? I hope everybody's liking this stuff. The response has been great. Let's keep working to help everybody understand how to move towards resolving your pain. There is no doubt that chronic pain is a global epidemic. There's roughly 1 billion people worldwide suffering from chronic pain, 130 million in the United States. There are people who just keep suffering longer and longer and longer, and you kind of end up, after you've gone through the medical system, you're left in one of 3 categories. You're addicted to prescription pain medication, you're told there's nothing that can be done, and you got to just live with your pain for the rest of your life, or you're told this is in your head, and you're just making up the pain. Basically, you're going to end up in one of those 3 categories. Don't end up there. Take responsibility for yourself and keep seeking, keep going out there, keep Googling, and eventually, if all goes well, you'll end up seeing a video like this And now you could come and get the real understanding as to how to diagnose and treat your pain. It's effective, it works, it is science-based, period. The medical system is not science-based. There's no logic to using diagnostic tests. They use correlative theory, which simply says that if I find a structural variation at the time you're having pain, I'll say that's the cause. That same MRI that found the herniated disc would also find that you have two elbows, so I can say having two elbows caused your pain in the same psychotic, false logic that the medical system said that herniated disc that was found at the time you're having pain is the cause of your pain. It's insane. Don't buy it. You need to interpret your symptoms. You speak a different language than the medical practitioners you are going to. You need to understand it. That is the core of why you will never get better. All right? I'm here to help. I'm your friend. I'm the guy who's trying to get you on the right direction so that you could be pain-free and fully functional. All right? For now, Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.